Hello again, thanks for joining. We have Victoria Tillman here, and she will be talking today about physical activity in epileptic patients. Thanks for joining.
Hi everybody, I'm Victoria Tillman, and I'm here to talk about physical activity in epileptic patients. I'm a Master's in Athletics training student here at Jacksonville State University, and I thank you all for having me here today. So just starting off with the background, what exactly is epilepsy? Epilepsy is a disorder that affects the brain that is caused by repeated seizures, and these seizures are unexpected disturbances that occur in the brain that cause electrical functioning changes. We have neurons within our brain that relay both chemical and electrical signals that can sometimes malfunction, which cause epilepsy. Some common triggers of epilepsy include lack of sleep, patients taking pain medications, antidepressants, any history of head trauma, and alcohol usage. Also, epilepsy can cause difficulty in learning, breathing, injury, and can cause permanent brain damage. Moving on, some dangers of epilepsy include an increased blood pressure with most type of epileptic seizures, but some of those symptoms depend on the type of seizure a patient has. So for example, in a focal seizure, a patient will have a loss of consciousness, which can also include sensory skills that do not feel real. In tonic seizures, the body will stiffen up, all our muscles will stiffen up. In myoclonic seizures, the body will twitch or have jerks. And in atonic seizures, the head will involuntarily fall or drop, usually following the body. So for my clinical scenario, quoted up to 3.4 million people in the United States reportedly have active epilepsy. Some activities of daily living and persons with epilepsy, also known as PWE, face barriers to safe and confident exercise that can negatively impact disease management. So for my focused clinical question, my population were epileptic patients. My intervention was physical activity. I had no comparison. My outcome was increased or decreased signs and symptoms of seizures. Coming all together to form will physical activity in epileptic patients increase or decrease signs and symptoms of seizures. So for my search strategy, the databases I used were PubMed, Medline, JSU Library, Sport Discus, and Google Scholar. My search terms were epilepsy and physical activity, seizure and sports, physical activity, and seizure. And for my evidence, I had a total of 375 articles that I dwindled down to 5 main articles I will be discussing today. My inclusion criteria included randomized controlled blind and double-blind trials, systematic reviews, observational studies, and meta-analyses. This criteria avoided selection bias. It gave a definitive answer on the selection of studies, and it also raised controversy around conflicting studies. For my exclusion criteria, I included cohort studies, articles published greater than 10 years ago, and qualitative studies, as this criteria is susceptible to inconsistency between research question and the methodology, and it also includes smaller sample sizes. This is my evidence quality assessment. Here are my 5 articles that I used. 4 out of 5 are graded on the Quadus, Prisma, and Strobe scale. They're all graded pretty high, as the Arita et al. Article was a randomized control trial that is usually graded on a jaded scale, which is graded out of 5 levels, and that control trial graded a 4. So it was a high level of evidence. So starting off with my first article, talks about epilepsy and physical exercise. This was a Norwegian study that was conducted to determine the effects of physical exercise and the risk of sustaining seizure-related injuries. So the results of this study showed that patients should be encouraged to exercise and play sports under specific recommendations, but advised to consult with their physician first. So in this case, this is where the enactment of a seizure action plan can come into hand, which is a pre-planned set of instructions that include instructions for anyone around the patient to follow, medications or medical information if the patient were to be found unresponsive. The strengths of this article showed that patients recognize symptoms or avoid activity that can cause epilepsy. For example, recognizing symptoms or an aura which a patient can feel, which is a warning sign before a seizure is about to come on. You can follow the seizure action plan as well with that. This article also gives recommendations for higher risk sports, and these higher risk sports are including lacrosse, football, rugby, and wrestling. The weaknesses of the study showed that it was performed on rats, which is not really beneficial towards the human growth of research in epilepsy, but it did show some positive findings. And the study also included an additional study that was only performed on men aging 40 years and older. My second article talks about sudden unexpected death in epilepsy, also known as SUDEP. This article talked about how SUDEP cardiac causes are linked to epilepsy-related disruption that is associated with the central autonomic control of cardiorespiratory function. The results of the study showed that the control of epilepsy, and particularly control of generalized tonic-clonic seizures, is the best initial strategy to reduce the risk of sudden unexpected death. The strength showed that SUDEP is the major cause of epilepsy-related premature mortality, but the weaknesses showed that there was a need for neuroimaging and molecular genetic studies into causes and risk prevention for SUDEP patients. The next study talks about sudden cardiac death being a risk factor, having a history of seizures. This study resulted in physicians should take a more thoroughly in-depth, detailed history and collaborate to mitigate the risk of sudden cardiac death while encouraging ongoing physical activity when safe. The strengths of this show that epilepsy affects the heart rate and can develop into cardiac arrhythmias. Some of these cardiac arrhythmias and signs include tachycardia and heart palpitations, which are present in both sudden cardiac death and epilepsy that could potentially be misdiagnosed, also including ventricular arrhythmias. The weakness of this study showed that the association of seizures with young sudden cardiac death is still under investigation. My next study showed the potential role of physical exercise in the treatment of epilepsy. The results of this study showed that the data suggests a role for exercise as an adjunctive form of therapy for epilepsy and as a tool for the promotion of health and wellness in this population. The strengths were that persons with epilepsy and physical activity aids treatment of depression, stress, mental state, and social skills. And the weaknesses showed that there was an aerobic training program that was conducted over 4 weeks, but it did not change the average seizure frequency. But the aerobic training program did increase our maximal aerobic capacity, it increased work capacity, it reduced heart rate, and also had weight reduction with reduced body fat. And my last article talks about the effects of physical activity training methods on epilepsy. This article just talked about different training methods and how it affects epilepsy signs and symptoms. And the results of the study show that it was performed to compare the effectiveness of different types of physical exercise. It was aimed to provide the most up-to-date evidence and recommendations for both clinicians and epileptic patients to choose. So the strength showed that both aerobic and resistance exercise had the most positive effect on epileptic patients, but the study was unable to define an optimal physical exercise for persons with epilepsy. So the clinical bottom line, the purpose of this is just to bring awareness to epilepsy. I was an athlete and later on developed epilepsy. I feel it's an important topic we should talk about not only in athletic training but among the sports medicine field. The relevance of this study is kind of just how big of a deal it is when you're dealing with epilepsy and the signs and symptoms being so similar to sudden cardiac death. It's something that healthcare providers should diagnose and create intervention strategies for patients as research grows. The answer to my PICO question was that physical activity ultimately, compared to research right now, shows that it does decrease signs and symptoms of seizures. And some precautions are just hazardous activities that patients should avoid. This includes scuba diving, skydiving, free climbing, motorsports, and rock climbing. Implications, the challenges I faced were limited evidence. I didn't have a lot to read and a lot of studies were performed on animals. There were also some studies that I avoided because they focused on the sedentary lifestyle that patients with epilepsy kind of lean towards after giving up wanting to participate in physical exercise. To athletic trainer profession, it shows injury prevention, so it kind of prepares athletic trainers how to follow, for instance, a seizure action plan and just list of instructions and how to educate others within their field, and also providing treatment, so just knowing the common protocol if a patient were to go into a seizure. And then as an athletic training student, I feel like this is educating not only to me to help me learn more, but also to help others learn more and continue to go into the advancement of research, as there was not a lot, but I feel like more we go into, the more signs and symptoms and the more cause and effect scenarios that we have, there would be a lot more to find out about epilepsy and physical activity in patients with physical exercise. So just concludes, sports associations now encourage persons with epilepsy, also known as PWE, to participate in sports, but persons with epilepsy are more likely to become sedentary. That sedentary lifestyle leads to a higher body mass index and increases minor physical resistance, causes low self-esteem, which can dwell into more of a likelihood of anxiety and depression. And here are my references, and I would like to thank the JSU Student Symposium, to my instructors and my classmates, and my beautiful family. Thank you all so much. Any questions?
I've got one.
Yes.
So you mentioned aura. From a person who has migraines, that was interesting. So what is aura like for epilepsy?
Okay, so just speaking, again, just based off personal preference, just an aura is kind of like a situation kind of when I referred to the focal seizures as your sensory skills are not real. It's a warning sign. So it could be whether it's sight, taste, smell, hear, anything like that. It just doesn't feel real. And so kind of in the moment before you're about to have an epileptic seizure or anything like that, it's kind of the world just stops around you and you're kind of just fogged up and buzzy, and that's kind of just can be a warning sign in some cases of seizures that patients can understand and know to stop what they're doing and prepare for the seizure to come on.
Is there a typical, like, sort of average, how much lead time do most people get, if any?
I don't have like a definite answer of like time frame among all types of seizures, but I know like from just personal experience, mine is usually about like 15 to 30 seconds before I know that I need to stop what I'm doing. So,
Yeah, thank you very much for this fascinating study. What's your next step? Do you plan to continue this research?
I've been into research since I was in high school. I didn't really follow through with it, but as we went into this CAP presentation, they just told us to pick a topic that kind of interested us, and just epileptic patients in general. And like I said, I feel like there's not enough attention in research as well. So me personally, I would love to start something and get something started, but I think it would take more than me. It would take a lot more people just to kind of advocate for those patients that are in physical exercise and do deal with epilepsy. But I think it is something that should be addressed and should be spread among and should be talked about. Just like even when we go through emergency action plans and stuff with schools, it's like you don't really have an action plan for seizures. It's some people don't know, like, do you leave them on their back? Do you turn them to the side? Do you pick them up? Do you put something in their mouth? It's like just kind of just advocating for seizures and patients that do physical exercise.
Great, thanks.
Any other questions? Well, let's thank our speaker again.